Hi, I'll be briefly describing the study that we've done looking at the impact of BRCA1 and BRCA2 mutations on survival among women with ovarian cancer. You're probably familiar with the genes BRCA1 and BRCA2 because where germline mutations in these genes are risk factors for both breast and ovarian cancer. While mutations in these genes are rare in the general population, they're fairly common in ovarian cancer patients, occurring at a frequency of about 10 to 15%. Mutation carriers differ from non-carriers with ovarian cancer in clinically important ways. For example, we know that they differ in their tumor characteristics and also in their age at diagnosis. And there's also some suggestion that survival following diagnosis may be different between these groups. There have been several studies that have looked at this. Many of them have had methodological issues, and all of them have been limited by sample sizes. The result of this is that our knowledge of the precision of the survival differences between groups is limited, and we also don't know if BRCA1 and BRCA2 carriers show similar survival patterns. So we performed a large multi-center study of survival among women with ovarian cancer, both with and without germline mutations in BRCA1 and BRCA2. And our goals were to both obtain more precise estimates of the relative survival between these two groups, and we also wanted to compare the relative survival between BRCA1 and BRCA2 carriers. So in order to do this, we collected data from 24 studies throughout the world. In total, we had survival data available on 3,500 women with ovarian cancer. And our main findings were that we found a significant survival advantage for both BRCA1 and BRCA2 carriers. And probably most importantly, we found that BRCA2 carriers show an improved survival relative to BRCA1 carriers. And to give you a sense of the magnitude of these survival differences, I'm showing a plot of the cumulative survival up to 5 years following diagnosis. We found that 36% of women without mutations in BRCA1 or BRCA2 survived up to 5 years following diagnosis. This was 46% for BRCA1 mutation carriers and 61% for BRCA2 mutation carriers. So these are fairly substantial survival differences. So in conclusion, we've presented the first solid evidence that BRCA2 carriers show a distinct clinical course from BRCA1 carriers. Our findings don't have any immediate impact on clinical practice, but they do have important implications for both clinical prediction and also trial design, particularly for clinical trials. So the next step would be to understand the mechanism driving these survival differences. There's evidence from in vitro work and some retrospective clinical studies that response to chemotherapy may be different between carriers and non-carriers. So this could be one possibility. But there also could be biological differences that we're not yet aware of that exist between BRCA1 carriers and 2 carriers and non-carriers that could be driving this association. So it would be interesting to try to tease these two mechanisms apart. Thank you.